Today I'm going to discuss about underbite case that I did with fixed orthodontic treatment. Hi, my name is Dr. Dinu and I'm an orthodontist. So when this patient had come to me, she had a chief complaint of an underbite. As you can see, her anteriors, that is her lower anteriors, are placed in front of the upper anteriors in a crossbite in the anterior region. She did not have any complaints about her aesthetics or facial appearance, just about the underbite that is present. So according to the chief complaint, the treatment plan was just to correct the underbite in the situation and correct the posteriors as much as possible. She had a restoration in the posteriors. So what we planned were to start with the normal MBT brackets, start initially with own two round wires, night tie round wires. The main thing, the bite was opened in the posterior region as to relieve the anterior crossbite or the anterior lock of the upper and lower incisors. Once the anterior lock was opened and the initial leveling was started, we could use the properties of night tie and bring the upper anteriors more and more front. Crossbite was gradually corrected as we changed from O12, O14 and O16 night tie arch wires, and then we changed to the 725 night tie arch wires and the later rectangular arch wires to introduce torque into them. We were able to finish it in an ideal occlusion as much as possible. The uppers were slightly proclined and the lowers were made as much as possible upright, and we were able to achieve a positive overjet in the anterior region. The patient was happy with the treatment we gave her, and she was not much concerned about aesthetics, but we were able to achieve a positive profile on her. The anterior teeth was brought in front in relation to the lower anteriors. The treatment was finished without any extraction. In relation to the soft tissue, the upper lips were posteriorly placed in before the treatment. Now we could bring the upper lip slightly forward in relation to the lower lip, and the aesthetics improved. So she was happy with the aesthetics. She was happy with the smile. Skeletally, as the patient was still class 3, her mandible or chin was forwardly placed. She will consider surgery later after 18 years of age. So if she needed to improve her aesthetics, she could still do surgical correction later, bring the chin slightly backward and correct her class 3 profile. So the ideal correction for a class 3 case or a crossbite case is, if it is surgical, it is always surgery. But in some cases, if the aesthetics and the bite is proper, we can go for a non-surgical and non-extraction method to correct the anterior crossbite with simple opening of the bite and simple leveling of the anteriors, which will bring the anteriors forward and bring into a proper occlusion. So I hope you guys that this video is helpful.